Anne-Lise Børresen Dale, you're here from Norway, where you're indeed a professor of molecular tumour biology, but specifically you are chairing or co-chairing the scientific committee of the forthcoming European Multidisciplinary Cancer Congress. But together we have two presidents with you. Also, we've got David Kerr from ESMO, president of ESMO. Hello, David. And Michael Baumann from ECCO. It's good to have you all here because Anne-Lise has assembled for us a wonderful selection of things in Stockholm for the forthcoming Congress that's coming up. Now, bench science, translational science, is being married or joined to or discussed with clinical science. What have you got in store for us, Anne-Lise?
I think we are more translational than ever in actually trying to translate findings from the lab to the clinic and then back again to understand why it didn't work. And then we have a wheel that spins from the bench to the bedside.
I know you've got a 3 Bs analog.
Yes, so I usually say that you take things, you start with the bed, you have the patients, and then you go to the bench, and then because we create so many, huge amount of data, you have byte as in gigabytes, and then you go back to the bench and to find out what is the right treatment for that particular patient, and then you go to the patient again.
And as this wheel rotates, everything gets better, is that right?
That's what we hope. So it's like a spiral that goes up. The more we know, the better we will do for the next patient. So I think every patient is sort of a experiment for the next one coming in. So I think we will get better and better, more personalized, better treatment, earlier treatment, and less side effects in the end.
Now, many scientists, though, do science for the joy of doing science, and they kind of trust that it will have an application. Is that something you want to combat? Do you want to make it more applied?
I think that for most of the basic scientists, at least in the medical sciences, it is for a purpose we're there. And I think for us, it's working close with the clinicians. It's been becoming more and more also a word for us that work on the basic, on the bench side, that you can see it's much shorter time from something that you have in the lab until you actually can try it out in the patients.
What's special about the Stockholm meeting? You're planning it, you're co-planning it anyway. What is going to be different to make it more multidisciplinary, more translational than previous cancer conferences?
I think we're closer to get it into personalized medicine, and I think it's the combination of basic scientists and the clinicians that work together, which they have been working for some years, but this is coming closer and closer, and you can see that the one is depending on the other one, and that works both ways.
When you say personalized medicine, explain.
That means that you're going to find the right treatment for the right patient at the right time.
Sounds great in theory. Is it that easy?
It's not that easy, and I think that, you know, we're facing a challenge with, for example, the Genome Cancer Atlas. Is something wrong with our genes in the cancer? So we have to find what is particularly wrong for that patient and how to treat it. And this is a slow process. We have some big jumps, and then, of course, we set back again, but then we have to move forward.
Now, I want to ask you about some of the highlights of the meeting, but first, could I turn to you, Michael, about your thoughts about this whole idea of mixing translational science, indeed bench science, with patients in the bed, bench to bed to gigabyte or byte?
No, I definitely think that is what we see happening in research as well as in clinics. We really have teams which are set together by not only different medical disciplines, but also by basic scientists and clinicians to promote what we can learn in the clinics to the lab and back. And that really brings the progress which we need in oncology.
Do you feel that in your area, head and neck cancer, for instance, thorax cancer, that there has been a big gain from the scientists recently?
In head and neck cancer for sure, and in intrathoracic cancer we are working hard on that.
David Kerr, what do you make of all of this idea of bench to bedside to byte?
I think it's going to be a fantastic meeting. Anne-Lise and Jean-Charles Soria have done a brilliant job on our behalf of pulling together what I think is going to be one of the most exciting conference agenda, of the next coming 5 years. Building on the metaphor that Anne-Lise has given us, that sense of the cyclical nature of things. Ecclesiastes said there's a time for all things. And I think now we, cancer researchers, cancer scientists, cancer clinicians, I think we're, if you like, the flag leaders for personalised medicine. And I like the idea of bench to bedside, but back again, a virtuous cycle of knowledge. So something very strong about that.